What is the primary purpose of the Braden scale? Your options are to assess risk for pressure ulcers, to evaluate cognitive function, to measure pain intensity, or to monitor blood glucose levels. The correct answer is A, that is to assess risk for pressure ulcers. The Braden scale is a tool used to assess the patient risk for developing pressure ulcers, bed sores, based on the factors such as mobility, activity level, moisture, nutrition, and sensory perception. It helps to healthcare providers to implement preventive measures for at-risk patients. Question number 26. Which of the following is an appropriate nursing intervention for a patient experiencing dyspnea? Your options are encouraging deep breathing exercise, administering a sedative medication, applying a heat pad to the chest, or encouraging the patient to lie flat. The correct answer is A, that is encouraging deep breathing exercises. Encouraging deep breathing exercises can help alleviate dyspnea, difficulty breathing, by promoting lung expansion, improving oxygenation, and reducing anxiety. Other intervention may include positioning for optimal respiratory mechanics and providing supplemental oxygen as needed. Question number 27. What is the primary purpose of the Glasgow Coma Scale (GCS)? Your options are to assess motor function, to evaluate cognitive function, to measure neurological status, or to monitor vital signs. The correct answer is C, that is to measure neurological status. The Glasgow Coma Scale (GCS) is a neurological assessment tool used to evaluate a patient's level of consciousness based on eye opening, verbal response, and motor response. It is commonly used in patients with head injuries or altered mental status. Dear friends, welcome back to Dear Competitive Exam YouTube channel. Today, you are attending 100 most repeated and most important question answer session based on nursing interviews. And this is the part 2 of this 100 most important nursing interview questions answer series. And I'm sure that you don't want to miss the first part, as the first part contains very important questions, very special questions based on nursing interview. So the link of the video has been given in the descriptions, or you can click on this I button to find it. And the next part will be uploaded tomorrow. Let's continue. And friends, if this video is helping you, then make sure to hit that subscribe button below. Your support means world to us. So don't miss out. Hit subscribe now and let's keep the journey going together. Let's continue. Question number 28. Which of the following is a symptom of hyperglycemia in diabetes mellitus? Your options are excessive thirst, bradycardia, hypotension, or confusion. Correct answer is A, that is excessive thirst. Hyperglycemia or high blood sugar can cause symptoms such as excessive thirst, frequent urinations, fatigue, and blurred vision. It is important for patients with diabetes to monitor their blood sugar level and manage hyperglycemia to prevent complications. Question number 29. What is the recommended position for a patient experiencing a seizure? Your options are prone position with head turned to the side, supine position with head elevated, side lying position with head and neck supported, or sitting upright with legs elevated. Correct answer is C, that is side lying position with head and neck supported. The side lying position with the head and neck supported is recommended for a patient experiencing a seizure to prevent injury. to maintain airway patency and to facilitate drainage or oral secretions. This position helps to protect the patient from aspiration and trauma. Question number 30. Which of the following is the common symptom of hypothyroidism? Your options are weight loss, tachycardia, cold intolerance, or diaphoresis. The correct answer is C, that is cold intolerance. The cold intolerance is the common symptom of hypothyroidism, a condition characterized by low thyroid hormone levels. Other symptoms may include fatigue, weight gain, dry skin, constipation, and depression. Question number 31. What is the primary purpose of in situ spirometry? Your options are to promote deep breathing, to measure oxygen saturation, to assess lung compliance, or to administer bronchodilator medication. The correct answer is A, that is to promote deep breathing. In situ spirometry is a respiratory therapy technique used to encourage deep breathing and to improve lung function after surgery in patients with respiratory conditions. It helps to prevent atelectasis and promotes optimal lung expansion. Question number 32. Which of the following is a symptom of fluid overload? Your options are hypotension, tachycardia, decreased urine output, or dry mucous membranes. The correct answer is B, that is tachycardia. Tachycardia or rapid heart rate is a common symptom of fluid overload due to the increased volume of blood circulating in the body. Other symptoms may include hypertension, edema, shortness of breathing, and increased respiratory rate. Question number 33. What is the primary purpose of a tracheostomy tube? Your options are to deliver supplemental oxygen, to provide mechanical ventilation, to bypass an obstructed upper airway, or to administer internal feedings. The correct answer is C, that is to bypass an obstructed upper airway. The tracheostomy tube is inserted into the trachea to bypass an obstructed upper airway, to facilitate breathing, and to provide an alternative route for mechanical ventilation if necessary. It may also be used to suction respiratory secretions and assist with vening and mechanical ventilation. Question number 34. Which of the following is an appropriate nursing intervention for a patient with a fever? Your options are applying cold packs to the axilla, encouraging increased physical activity, administering antipyretic medication, or providing a warm bath. The correct answer is C, that is administering antipyretic medication. Administering antipyretic medication such as acetaminophen or ibuprofen is an appropriate nursing intervention for a patient with a fever to reduce temperature and alleviate discomfort. Other intervention may include promoting adequate hydration and rest. Question number 35. Which of the following laboratory values is indicative of hypokalemia? Your options are elevated serum potassium levels, decreased serum sodium levels, elevated serum calcium levels, or decreased serum potassium levels. The correct answer is D, that is decreased serum potassium levels. The hypokalemia is characterized by a decreased serum potassium levels and can lead to symptoms such as muscle weakness, cardiac dysrhythmias, and fatigue. It may be caused by factors such as diuretic use, vomiting, or diarrhea. Question number 36. What is the primary purpose of the RACE acronym in fire safety? Your options are: remove patients from danger, activate the fire alarm, extinguish the fire, or confine the fire. The correct answer is D, that is confine the fire. The RACE acronym stands for Rescue, Alarm, Confine and Extinguish or Evacuate, which are sequential steps to follow the event of a fire. Confine refers to containing the fire by closing doors and windows to prevent its spread. Question number 37. Which of the following is a common complication of peripheral intravenous IV therapy? Your options are: hypoglycemia, phlebitis, hypertension, or bradycardia. The correct answer is B, that is phlebitis. The phlebitis, inflammation of the vein, is a common complication of peripheral IV therapy and may present with symptoms such as pain, redness, swelling, and warmth along the vein. Proper insertion technique, site rotation, and catheter care can help to prevent phlebitis. Question number 38. What is the primary purpose of nasogastric NG tube? Your options are: to administer internal feedings, to monitor intracranial pressure, to provide supplemental oxygen, or to drain cerebrospinal fluid. Correct answer is A, that is to administer internal feedings. The nasogastric NG tube is inserted through the nose and into the stomach to provide internal nutrition, administer medications, decompress the stomach, or to remove gastric contents. It is commonly used in patients who are unable to tolerate oral intake or require nutritional support. Question number 39. Which of the following is a potential complication of immobility in hospitalized patients? Your options are: decreased risk of pressure ulcers, increased risk of deep vein thrombosis, increased muscle strength, or improved respiratory function. The correct answer is B, that is increased risk of deep vein thrombosis. The prolonged immobility increases the risk of deep vein thrombosis, DVT, a blood clot that forms in deep vein, typically in the lower extremities. Other complications of immobility may include pressure ulcers, muscle weakness, and respiratory complication. Question number 40. What is the primary purpose of the Bishop score in obstetrics? Your options are: assessing fetal heart rate, evaluating the readiness of cervix for labor induction, monitoring amniotic fluid levels, or measuring maternal blood pressure. The correct answer is B, that is evaluating the readiness of the cervix for labor induction. The Bishop score is used to assess the cervix's readiness for labor induction by considering factors such as cervical dilation, effacement, and fetal station. Question number 41. What is the purpose of a Foley catheter? Your options are: to monitor cardiac output, to administer intravenous medication, to drain urine from the bladder, or to measure intracranial pressure. And the correct answer is C, that is to drain urine from the bladder. The Foley catheter is a flexible tube inserted into the bladder to drain urine. It is commonly used in patients who are unable to urinate on their own due to surgery, injury, or certain medical conditions. Question number 42. Which of the following is not a function of the endocrine system? Your options are: regulation of metabolism, regulation of blood sugar levels, coordination of voluntary movements, or regulation of growth and development? The correct answer is C, that is coordination of voluntary movements. The endocrine system regulates metabolism, blood sugar levels, growth and development, and the various other physiological processes through the secretion of hormones, but it is not directly involved in coordinating voluntary movements. Question number 43. Which class of antibodies is the most abundant in the bloodstream of human immune system? Your options are IgA, IgD, IgG, or IgE. And the correct answer is C, that is IgG. IgG antibodies are the most abundant class of antibodies in the bloodstream, providing long-term immunity against a wide range of pathogens and toxins. Question number 44. Which of the following is not a part of the respiratory system? Your options are lungs, trachea, esophagus, or bronchi. The correct answer is C, that is esophagus. The respiratory system consists of organs involved in the breathing such as the lungs, trachea, bronchi, and diaphragm. But it does not include the esophagus, which is the part of digestive system. Question number 45. Which cells are involved in the clearance of immune complexes and dead cells in the human immune system? Your options are macrophages, neutrophils, dendritic cells, or mast cells. The correct answer is A, that is macrophages. Macrophages play a central role in phagocytosis and the clearance of immune complexes, apoptotic cell, and cellular debris, contributing to tissue hemostasis and resolution of inflammation. Question number 46. Which structure produces bile to aid in the digestion? The options are liver, stomach, gallbladder, or pancreas. The correct answer is A, that is liver. The liver produces bile, a greenish yellow fluid that aids in the digestion and absorption of the fats in the small intestine. Question number 47. What is the primary function of white blood cells, WBCs, in the human body? Your options are transportation of oxygen, defense against infections, blood clotting, or nutrient absorption. The correct answer is B, that is defense against infections. White blood cells play a crucial role in the immune system, defending the body against pathogens such as bacteria, viruses, and other foreign invaders. Question number 48. What is the primary cause of gastroesophageal reflux disease, which is known as GERD? Your options are excessive stomach acid, bacterial infection, viral infection, or autoimmune reaction. The correct answer is A, that is excessive stomach acid. GERD, which stands for gastroesophageal reflux disease, is often caused by the backflow of stomach acid into the esophagus, leading to symptoms like heartburn. Question number 48. What is the function of the pancreas in digestion? Your options: producing insulin, producing bile, producing digestive enzymes, or storing nutrients. The right answer is producing digestive enzymes. The pancreas produces digestive enzymes
that includes amylase, lipase and proteases, which aid in the digestion of carbohydrates, fats and proteins.
Question number 49. What is the primary purpose of the Glasgow Coma Scale (GCS)? Your options are to assess motor function, to evaluate cognitive function, to measure neurological status, or to monitor vital signs. The correct answer is C, that is to measure neurological status. The Glasgow Coma Scale (GCS) is a neurological assessment tool used to evaluate a patient's level of consciousness based on eye-opening, verbal response and motor response. It is commonly used in patients with head injuries or altered mental status. Question number 50.
Which class of antibodies is the most abundant in the bloodstream of human immune system? Your options are IgA, IgD, IgG or IgE. And the correct answer is C, that is IgG. IgG antibodies are the most abundant class of antibodies in the bloodstream, providing long-term immunity against a wide range of pathogens and toxins. Repeat. Friends, it is a time to comment your score out of 25 questions. And friends, thanks for joining us and learned something new. Then give us a thumbs up and let us know in the comment section. And don't forget to subscribe and hit that notification bell so you never miss out on our upcoming exploration of fascinating topics in the medical field. Until the next time, stay curious, stay healthy. See you. Take care.